Welcome to Ask Dr. Mingle. This is the QA series from Mingle Health answering your questions about quality programs and the transition to value-based care. I'm Dr. Dan Mingle, family physician, founder, and CEO of Mingle Health. With me here today is Brigid Whitney Gallagher, Manager of Client Services at Mingle Health. Brigid will be helping us to understand QPs, or qualified participants, in Medicare's advanced alternative payment models. Welcome, Brigid.
Hi, Dr. Mingle. Lovely to chat with you.
So to start, Brigid, what is a qualified participant and why should people care?
Great question. So, a qualified participant, or QP, as it's commonly referred to, is a Medicare provider who is participating in an advanced alternative payment model, or an advanced APM. To be a QP, the provider has to meet some specific benchmarks related to patient participation within the APM. And the key takeaway about being a QP is that they're eligible for the advanced APM incentive payment, and they are not subject to the MIPS payment adjustment.
Now, how does a provider get to be a QP?
A provider becomes a QP based on attributed patients. So CMS makes a calculation by looking back in time, and they compare the total number of Medicare patients that a provider saw under the number of Medicare patients that were attributed to the ACO. That becomes a percentage. In order to be a QP, CMS is looking to see 75% of the patients, Medicare patients that were seen and treated, be attributed to the ACO. That same sort of logic applies towards payments. So again, we're looking at total number of Medicare payments as your denominator, Medicare payments associated with the ACO as your numerator, and we're trying to achieve a 50% level with that calculation.
So, Brigid, when is the QP status determined? Is it once a year or how's that done?
This is measured 4 times during the year. The information is published by CMS in something they call a snapshot. So they take a snapshot that is released in July. So it's published on the QPP website in July that covers patients seen and treated from Jan 1 to March 31. Then in October, they release another snapshot, another result that's calculated from Jan 1 to June 30th. And then again in December, they release the third snapshot that is Jan 1 through the end of August.
Brigid, is that calculated by provider? Is it by practice or is it by APN entity? How's that done?
Yeah, so every calculation, every snapshot period, Medicare is looking at patients by provider and by APM entity. So there are a couple different calculations that happen. Medicare is going to use the highest status or the best case scenario. So for example, if you are an individual provider and you achieve 75% in your patient count, but don't achieve the required 50% in your payment count, that's okay. Achieving it in your patient count qualifies you as a QP. The same as if in the first snapshot you are a QP and the second snapshot you're not, that's okay. You still get the qualified participant designation. Also, the individual provider score, so how you score as a NPI, as opposed to how the entire APM scores, you'll get the better of the two.
Now, what is the advantage of being a QP?
Yeah, so the best part about being a QP, I think for a lot of providers, is not having to be concerned about their MIPS score. Being part of a advanced payment model as a QP allows the provider to receive the annual advanced APM incentive payment, so they're not having to worry about that negative 9% MIPS adjustment or maybe a positive percent adjustment in MIPS. It's hard to tell. They don't have to be concerned about that. That QP status protects them from that uncertainty.
Great. And now I've also heard the term partial QP. What is that?
Yeah. So a partial QP is essentially a QP that doesn't quite hit all the benchmarks and the numbers that a full QP is expected to hit. So the partial QP has a lower threshold to hit when it comes to percentage of Medicare patients attributed, and a lower threshold for payments attributed as well. The downside that could be for those folks is that a partial QP does not get the advanced APM incentive, but they can choose if they want to participate in MIPS. Theoretically, as a partial QP, you could report MIPS and earn an incentive, or you could decide that reporting MIPS isn't going to be beneficial for you as a individual, and then you simply wouldn't report, and there would still be no MIPS penalty.
Well, thanks. I think that makes things clearer for me. Now, how do I know what my QP status is?
The only way to know for sure what your QP status is to go to qpp.cms.gov and put in your NPI. The QP status is determined by CMS. You might have a vendor like Mingle Health, or maybe a billing company that can do calculations and say, oh no, you haven't hit this mark, you have hit this mark. All of that aside, CMS is the final arbiter. So if CMS identifies you as a QP, partial QP, or as not a QP, that is the designation that you will be scored against. We also really strongly recommend that providers and practices review that information and really understand it. CMS does a great job with calculations, but certainly there's the possibility for mistakes. And as a provider, we know that you want to have your care represented most accurately. If you do see something you believe to be incorrect, please put in a help desk ticket. CMS is very responsive with those.
Well, thanks, Brigid. This has been real helpful. And remember, anyone out there, if this just stimulates more questions in your mind, don't hesitate to send those to us. If you have other perspectives on this or heard or understand other things, also don't hesitate to send us the reference. Um,
Dr. Mingle, I have a question for you. What is the incentive payment that a QP can expect? So we know that they can earn the advanced APM incentive. What is that? What does that look like for 2024?
Great question, Bridget. I'll start with a straight out answer, and then I'll explain for everyone else the confusing terms that I'll introduce. For the 2023 performance year, the APM incentive is 3.5%. Now, after that's paid out, these incentives will no longer be paid as a lump sum. The lump sum incentive payment is being replaced by a higher conversion factor paid to QPs, that is qualified participants, on the physician fee schedule. Rather than a lump sum, QPs will enjoy slightly higher payments on every Medicare reimbursement check. Now, there's lots of room for confusion here as we consider performance year, base year, and payment year. It's really confusing, and I've had to carefully dissect the regulations to be sure I have it right. And I'm still not absolutely sure. So if you find a credible reference that tells you something different, I'd be grateful if you'd share it. Any of you listening in, you remember that we can be smarter together. I believe that. Now, the definitive resource for this is the Electronic Code of Federal Regulations at www.ecfr.gov. Now, simply searching for 414.1450 should get you to the relevant passages, whether you're in the electronic code website using their search tool or whether you're going directly from your favorite search engine. Now, 2023 as a performance year set up qualified participants to get a 3.5% incentive that would be paid in the 2025 payment year. Now, this year, 2024, between the performance and payment years, is called the base year, in which the amount paid by Medicare to the qualified professional for 2023 will be determined. Next year, 2025, again, is the payment year in which 3.5% of your 2024 Medicare payments will be paid in a lump sum to 2023 qualified participants. Now, our last glimpse of the 3.5% APM incentive will be when it's paid in 2025. Then it's over. Now, I know I've lost many of you, so I'm going to say it again in a different way. There's a 3-year cycle to the APM incentive. There's a performance year in which you become or not a qualified participant or a QP. The next year, the second year of the cycle, is the base year in which Medicare payments are totaled per QP. And the final year, the third year, is the payment year in which you are paid the lump sum calculated by multiplying the base year payments times the performance year incentive earned.
Let me make sure I understand this. So in 2023, if I qualify as a QP, that is my performance year. 2024 is my base year. And during this time, CMS is keeping track of how much Medicare Part B dollars I'm paid. In 2025, I will get my 3.5% times my Medicare payments in 2024 awarded to me in a lump sum in 2025. Is that right?
Absolutely correct. You get an A and can go to the head of the class and get a job at Mingle Health. Now, with that 3-year cycle of APM incentives defined and understood by all now, as evidenced by Brigid, let's examine the history and the future of APM incentives. The 2017 through 2022 performance years defined who would earn a 5% lump sum incentive for being a QP. In each case, the next year as base years would define the Medicare payments on which the 5% would be paid. In the final year, the third year called the payment year, the last 5% APM incentive payment will or has been paid in the 2024 payment year. Now, we're doing this recording in 2024, so right now, qualified participants are waiting for the lump sum delivery of that last 5% APM incentive payment. This 3.5% lump sum payment earned in 2023 and to be paid out in 2025 is really a last minute addition by Medicare. They're in a transition from the 5% lump sum payment to a different method of incenting qualified participant status in Medicare provider population. And then they realized that the payment windows were different, and they had to add a second year, so you wouldn't have to go a year without incentive. So thus the 3.5 incentive payment was born that will be paid out in 2025. And then we moved to a different methodology. For participants who earn QP status in this 2024 performance year, their status will be confirmed or finalized in the 2025 base year, but in the 2026 payment year, instead of getting a lump sum incentive payment, your Medicare payments will be calculated from the physician fee schedule using a higher conversion rate than your non-QP peers.
So, what I think that means is that starting for the program year 2024, the payments that a QP receives in 2026 will not be coming in a lump sum incentive. It will be associated with the Medicare billing that happens in 2026. Is that right?
Yes, generally, Brigid. Specifically, it's going to affect the Medicare payments. For those of you who are familiar with the physician fee schedule, um, the fee Medicare pays is based on a relative value scale, and those are relatively stable as yearly a single conversion factor that's applied to all of those total relative value units is created that sets the amount that you're going to be paid with some geographic modifications. Um, so there are some automatic updates to that conversion factor, and Medicare intends, or they've stated the intention, starting with a 2026 payment year, that they will apply a higher conversion factor to QP payments than to everyone else's. And they'll continue to get a favorable payment year after year after that. Now, understanding that, I'm left perhaps with more questions than answers. Medicare says that the routine rise in conversion factor is 0.5% annually, and that henceforth qualified professionals will get a 0.75, so half again higher than than their peers. But looking back, it's not reliable that the conversion factor goes up 0.5% annually. There's a lot of other adjustments based on all kinds of legislation. In fact, from 23 to 24, the conversion factor actually went down. And then again in 2024, as of April 1st, it went up again for the rest of the year, not the whole way back to where it was in 2023, but it's up higher. And there's a lot of other one-time or repetitive adjustments to the conversion factor that occur in legislation. I believe that sequestration, which occurred, when was that? 20 years ago, is still applies. So the question is, how is this going to be administered? Are they going to start publishing two conversion factors in the physician fee schedule? It's not published that way yet. Or will there be a standard multiplier applied by fiscal intermediaries when payments are made? So for all QPs, multiply by X. Completely unknown. And will that differential compound annually, or will it always be that multiplier step above the usual conversion factor? So stay tuned. There's a lot more to come, a lot yet to be defined, but it is absolutely clear that Medicare's current intention is to stop paying lump sum incentives after the 2026 payment year that was earned in 2024. What you'll earn in 2025 is an increase in your conversion factor of all payments made in 2026 and beyond.
Thank you.
My pleasure. And thank you everyone for tuning in. It's always delightful to chat with you. Thanks for all the great questions. I want to be helpful and I want this to be useful to you. Don't hesitate to correct or supplement any of my answers. Share your experience, ask your questions. We can be smarter together.